Randy here on this beautiful Sunday morning. Doing something a little different this week. Marisa was sick this past week and didn't really get to go do anything. I didn't get any footage, but I had this idea about sharing my experiences with the socialized healthcare system here in Italy versus my experience as a military veteran utilizing the VA system in the United States versus my experience again utilizing private healthcare in the United States, because I thought it might be an interesting way to look at it. I also, for many years, was a licensed mental health counselor. I'm still a licensed mental health counselor, but I don't practice. And I was on the receiving end of private healthcare insurance as well, private and socialized healthcare insurance, which I'll talk about more down the road as we get going here. So basically, I just want to cover is socialized medicine as bad as they say it is? And I want to kind of compare my experience again. It's not a political thing. I don't care about politics. I really don't. I know some people want to make this political. It's not political. It's just facts. This is my experience. This is what I've been through. I can tell you what's good, what's bad on all of it. And you can take it at face value. But I'm not going to argue politics with anybody because I don't care, straight up. So save your comments about whatever. I don't care about politics. So let's just define socialized healthcare first, okay? And if you look at this slide, you'll see there's a definition. It's from Wikipedia, and pretty straightforward. I think it's our basic understanding of what socialized healthcare is. Taxpayer funded, and and it covers everybody, right? What's the healthcare system in the United States? That may be a little more nuanced in that sense. Like I said before, most of it is private healthcare. So you pay a premium every month to your insurance provider, and then based on the plan that you have, you may have certain copays, deductibles, and other expenses. In addition to that, you have the complexity of having to find a provider that's in network versus out of network, which your cost can be a lot higher on. So it's a lot more complicated. And again, I said I've been there. And I'll explain all of that here in a second. We're going to look at this slide. It's going to define what the healthcare system is in the United States. And again, that's Wikipedia, just giving a basic definition. All right. Now, what I was talking about before, the U.S. has socialized healthcare programs. And I know people are like, gasp, not socialism. It's not socialism, it's socialized healthcare. The United States has lots of socialized programs, if you think about it, many of which you can't live without. Police, fire department, highway infrastructure, public schools, public housing, some public utilities. It's there. It's taxpayer funded to do good for the community, okay? And it's necessary to some extent. And again, you see it's different. That, as Americans, we're always complaining about our taxes and whatnot, but that's what that tax money goes for. People complain, I don't have kids in school, so why should I pay this? Because it's a collective, and it doesn't put the burden on the people who really can't afford it the most. And I'm not going to go into the income disparities of younger adults versus older adults or middle-aged adults or any of that. You guys can look all that stuff up. And again, I'm not wanting to get political about any of it, but there are hard fact numbers that younger people don't make as much on average as older people. And people in their mid-30s to mid-50s make the highest incomes, typically across the United States. So anyway, I digress on that. There's two socialized healthcare systems in the United States that I'm aware of, and that I've actually been a part of at different times in my life. So the first one is Medicaid. Medicaid is for people who fall, typically it varies state by state, but they typically will fall about 138% above the poverty level. And the poverty level in the United States right now is 21,597. Not a lot of money. It's not even a full-time minimum wage job in most states. So do they need healthcare coverage? Yeah, I think so. You should be covered where you're not terrified to go, to the hospital or thinking that it's going to cost you a fortune to go see a doctor or whatever. I think it should be covered. Again, I know that's more of a political stance, but I've been in that system. I've needed it. And I've also been uninsured before, and it's not fun having medical issues pop up when you don't have insurance. So it's terrifying, to say the least. So the other socialized healthcare system is a VA medical system. All right. The Veterans Administration covers healthcare for all veterans. Okay. And for those that are veterans that are 30% disabled, service-connected disabled or higher, though the VA will cover their spouses and dependents. If the veteran is killed in action or killed while in service, the VA will cover the surviving dependents as well. When I first went into the VA system, it was the early 90s, right after I got out of the military. And I can say without a doubt, the VA system was horrific. It was bad. It was bad. I would have to drive 100 miles round trip to go see my doctor. Yeah, I got mileage. They paid, the VA would pay like 20 cents a mile or whatever it was back then, 15 cents a mile. I got mileage for it, but that really doesn't cover more than your fuel. It doesn't cover wear and tear or time. And then you would have a long wait time, even waiting for your doctor. They were often very, very delayed. And I would go have a 9 o'clock appointment, see my doctor. I might see him at noon, and that's not an exaggeration. So when I got my first salary job that offered insurance, I jumped on it. And I was in private healthcare system for many, many years because the VA socialized system was so bad. When my kids were born and we had moved from one state to another, I had a new job. I'd started, but I found that state of Florida actually at that time offered I don't know how to put it, like a partially subsidized Medicaid for kids, which was very nice. So I paid $100 US a month for both of my kids to have Medicaid because I was over the income limits, obviously, of Medicaid, but I still didn't make enough to add them to my private healthcare insurance, which I believe at the time, this would have been 2002, 2003, was going to cost me about $700 a month extra. So, and this was well before the ACA came out, and some of that got tempered a little bit, but not so much. So it would have been very expensive for me to have insurance for myself, my wife at the time, and my two kids. So we went with the route of my ex-wife, my wife at the time. She got insurance through her job. I had insurance through mine, and we insured the kids through the state program. And it worked fine. Again, with Medicaid, you have to find a doctor that takes Medicaid, and that can be difficult in and of itself. Let's fast forward a little bit. Kids grow up. I go back into the VA healthcare system around 2010, 2011, somewhere around there. I'd left the company I was working for, and I started my own practice, and I didn't have healthcare coverage. So instead of buying something through Marketplace, I just opted to go back to the VA. The VA had significantly improved since my first go around in the early 90s. And they had introduced something called community care. It was all brought about by something called the PACT Act. And again, that would be, there's tons of VA videos from other people that are experts in that can talk about all that stuff. Anyway, so what I found is that through the PACT Act and through community care, I was able to go see private providers on the VA's dime. And it was very helpful. And in addition to that, my prescriptions were mailed directly to my house. It's a very nice system. It's the system I would like to see implemented across the United States for everybody. I think it's fantastic. I had oftentimes the highest quality of care. I suffered a traumatic brain injury in 2012. The VA took amazing care of me. I saw one of the best neuropsychiatrists in the world, and he's in the Tampa VA Medical Center. He was an amazing man. Him and his staff really helped me get back to being able to, at that time, go back to work again and really get my life back. I've had other issues, medical issues that popped up. I saw a specialist in the Miami VA Medical Center who was one of 4 people in the whole United States that could actually do what I thought I might have needed done at that time. So it's impressive that they have that capability. My primary care doctor was at my local clinic, 10-minute drive away, and he handled everything for me. So quite a good system. The only flaw, if you will, in that system, and there's no prescription glasses that coverage, and I take that back. There is, to an extent. You got to pay a little bit. You got to buy the frame. You got to pay a little copay on it, but it's not free. There's no dental coverage for most veterans, and dental care can be expensive. So those are the 2 socialized systems. Now, why didn't I say Medicare? Medicare is not socialized. Medicare is universal to an extent, but everyone that has Medicare pays for Medicare. So if they're on a Social Security payment, that deductible, that copay rather, not the copay, the premium comes out of their monthly check. So they pay a certain part. It's a significantly less amount than private health care, but it still is a significant expense. And a lot of times they have copays on their medications and their doctor's visits and whatnot as well. So it can be very expensive. All right. Now I've had people ask me this, and they say it, so I put it in this slide, but healthcare is better in the USA, right? And I just went through this healthsystemstracker.org, and I'm just going to let you read what it says, but no. Long and short of it is a healthcare system in the United States is not better. I realize I just said that the VA system is great, and it is for the new system. And I think if they continued with that, and if that system went across the board for everybody, that type of system went across the board for everybody, the healthcare in the United States would spring to number 1. Honestly, I just believe that. VA has a huge amount of preventative healthcare measures in place that would help tremendously, from diet nutrition planning, from exercise programs called Move. There's tons of stuff like that. Dial a nurse, all those things that are available, and that you can just they can deal with little stuff, and before it turns into something major. So. Okay, now the other thing that I get is the wait times in the socialized healthcare system. They're horrendous, right? And I have to say that it depends on what you're doing. So again, this is about what I've gone through, not necessarily every system in particular. When I got to Italy, and I'm the spouse of an EU citizen, so that made a huge difference for me being able to get in Italy what's called a codice fiscale, which is basically your tax ID, and to get a tessera sanitaria, which is your health card. Your health card allows you to get into the universal system as if you were a citizen or a legal resident, okay? Because I am a legal resident. That gets you assigned to a private care a primary care doctor, which you can pick. There's a list of them. They'll give you a list, like you can pick. And at the time, we had picked a guy who spoke English, and that's what I wanted. So about the wait times, I got right in to see him right away. No big deal. And he ended up not being the doctor that I wanted or needed. So when I renewed my Tessera, mine renews every 6 months. So I renewed my Tessera, I changed doctors. So you're thinking, well, maybe I have to wait months. No, I go on Monday. I renewed my Tessera last Thursday and I go this Monday, the 4th. So 10 days, 11 days, I had an appointment with him. And I think he had an earlier appointment. I just couldn't do it. So I'm going to go see this guy on Monday afternoon. So for your primary care physician, the wait times are not bad at all. I think it's standard even in the U.S. You're going to go to a new doctor, it's going to be a week or two out. I know in my field of psychology that when I would send a client to find a psychiatrist, often in the area that I lived in, they were 2 to 3 months out to get that person in. For their first visit appointment. That wasn't even often, any detailed stuff. It's paperwork, my initially seeing you, and you're in and out, and I'll see you in a couple of weeks and we'll do it again, type of thing. So if you think about 3 months for a psychiatric issues, it's pretty significant wait. Anyway. Wait times here for specialists vary, and I had in other videos complained about that. I know there were times where I was trying to get into a doctor and you just can't. They're full. There's no specialist appointments available anywhere in the region. So you bypass that by going to a private specialist, and people say, well, that's expensive. It's not. It's not that much. My endocrinologist, my cardiologist. I'm trying to think who else I saw. The eye specialist, yeah, because I had to see him. So the eye specialist didn't charge me anything at all. And the other two were 100 each, 100 euros each, was about $114 for the visit and everything. And then after that, I'm in the system and I don't get charged again. That's kind of the beauty of that. So you see them, you pay, you're in the system. Boom, I don't pay them again for the next visit. The universal healthcare system does. So it's worth it to pay that up front for those that have it and get it out of the way. All right, the biggest negative that I found is I have to go see a specialist for my Praluent, and that was the other one I was charged for. And I'm charged once for that, and that's it. But I have to go see him once a year, and that's in Perugia. Now, Perugia is about 40 miles from here. Doesn't seem like a lot, but in Italy on the back roads, it's an hour drive up there. It's hard to find parking. It's an hour back. There's not a train that goes to the hospital in Perugia. So you have to get the train, take the bus, or get a cab, which for somebody who is at or below the poverty level here, it might be difficult for them. I have a car, I drive up there and I drive back. And there's no mileage reimbursement. There's none of that. I'm just out of pocket on that. But that's okay. That's the way the universal system works. You have these specialists that are all over your region. You just have to drive to them, and you kind of accept that. I had to see another specialist not too long ago, and it was an hour and 15-minute drive to go to the hospital to see this person. So we just made a day of it and, hung around, had a nice visit and saw the doctor and got out. But that would be the negative that I've seen so far. Okay, now on to other stuff. If I move to Italy, can I get healthcare? It depends. It's a big depend. Italy has universal healthcare coverage. And that means is that no matter who you are, you're here visiting, you're here on vacation, you're whatever, passing through, you get hurt, you go to emergency services, they will cover you, they will treat you, they will take care of you. And it doesn't matter. You have a catastrophic accident, you're in the hospital for months trying to recover, you're not going to get a bill. You don't have to worry about that. Completely different from the United States healthcare system. So that's one of the biggest things to consider in that. what did I put here? I'm going to put a slide up. I'll just let you read about it and see. But yeah, you can, if you're moving here like on an ERV, I think it's called, an elective resident visa, you will need to have some kind of an expat type healthcare coverage. My understanding is they're still pretty cheap. It's it depends on your health, your age, all that stuff, but it's several $100s a year, not a month. So it's a lot less. And you also still have the option of just going private to the doctor. Most of the primary care doctors charge 50 euros or less for a visit, and the specialists are usually 100 or less for a visit. So it's not a lot of money. And again, if you have to go to the emergency room, that's covered anyway. You wouldn't have to pay anything. Prescriptions are typically affordable here. What I found not to be so affordable are over-the-counter medications. And healthcare things like sunscreen, for example, is massively expensive. You get a little stick of sunscreen to put on your face. It's like 12 euros. It's crazy. So let's see what else. Anyway, again, this is my experience with it. I also want to cover real quick my experience as a provider and what the issues that I had, and one of the reasons I ended up changing everything toward the end of my practice. When I got into healthcare as a mental health counselor, I recognized I was going to have to take insurance, private insurance, and Medicaid, and all those things. And you have to get on what's called an insurance board. And so you jump through all these hoops, and it can take anywhere from 6 to 18 months for you to be established on the board. And then they have a book of rules that you have to follow, and I'm not making that up. It's page after page after page after page after page of terms and conditions. And it's different for each provider, which makes it all the more frustrating. So there was, once you get in and you start figuring it out, you start getting paid, but you give up so much. And on average, each year, I lost 40,000 US dollars in write-offs because insurance wouldn't pay for some nonsensical reason. The straw that broke the camel's back for me was when Medicaid decided, after me taking Medicaid for 12 years at that point, something like that, that I had a number, one of my numbers didn't match the number they had on the application or whatever, and so they stopped paying me. And even after they acknowledged that it was their typo, their error, I never got paid to the tune of 18,000 US dollars. So I had immediately stopped taking Medicaid at that point and was processing trying to get them to pay me. They never did. So I ended up utilizing a system where they take a percentage of the claim, and they make sure you get paid, and that worked out until I retired. So anyway, that's my take on socialized healthcare versus healthcare in the United States. I think if you decide to move to Italy or any EU country, or any country that has socialized medicine, I don't think you need to be worried about the quality of the healthcare. I think it's amazing. If you'll recall in one of my other videos, when I split my scalp open when I was mowing down in my olive grove, and I got caught by a branch and it ripped me open, we called for emergency medical services because I was bleeding like a stuck pig, and the EMT came out, and there was 2 of them, and they took my blood pressure, took really good care of me, cleaned me up. And she's looking at it, she's like, I put a couple stitches in, you'll be okay. I can do that right here, or you can go to the hospital. I'm like, yeah, do it. Boom, stitched me up, did a great job. I don't even have a scar anymore. It's not raised, it healed up. I called my doctor, told him what happened. He gives me a prescription, emails me a prescription for antibiotics. Take it to the pharmacy, it's free. And I get the antibiotics, and then I go in like a couple of weeks later to a clinic, and it's like a clinic, and they took the stitches out, and I was good to go. Cost me nothing at all. So I think in the United States and private healthcare, that would have been expensive. That would have been a couple $1,000s at least, just for the ambulance alone, I think. So that's the difference. You know, I used to be the person who said that insurance was not a right, that it was earned. And I don't believe that any longer. I think that healthcare is a right. And again, that may be political for some, but I don't see it as that way. I see it as basic human dignity. We should have a right to clean water. We should have a right to healthy food. We should have a right to good quality health care. And I think that's just a universal human right. So call me what you will, that's fine. But that's what I believe. And I think the older we get, a lot of times the more we realize that that's more important than money. On that note, the doctors here are salaried, and that's why it's not that expensive to go to see them. They all are paid a salary. The salary is based on their specialty, and it's, you know, they're doing a job. They're like a store clerk in that sense. Like I get in, I get paid, I do my job, I leave. Not saying they don't care, because some of them do, some of them don't care as much, but the quality is still there in the healthcare system here. So, all right, I encourage you to like and subscribe. I hope you like this. I apologize again that we weren't able to do a standard video. Next week, I've got another video similar like this, because we weren't able to do anything. And so I'm gonna take you fishing with me. If you wanna tune in next week, you go fishing with me on Lago Montepulciano. Like and subscribe, and ciao.